He said, without life, there is nothing we can do. So you must first make sure you are living in an environment that you and your family and your friends will be secured so that you can get the energy and even the zeal to move on with other things. COVID-19 is here with us. Currently, the new variants, I don't know whether it's still called COVID-19 or it's going to be COVID-20 or whatever. But as Doc said earlier, we all know how COVID-19 came to this country. And it is exactly a year ago, after the State of the Nations address, when the president traveled. And with all the negligence, instead of being proactive, we rather wait to become reactive. Upon all that happened, Senna, now we are here with a new variant, the UK variant. And we are in Ghana. We understand that out of emergency and we were not in normal times. That is why a company was contracted without due processes. Because we had the president's cousins going around explaining why the frontier healthcare services did not go through the right process. And that we were not in normal times, so we didn't have time on our hand. So now, since we close our borders, any reasonable government will know that definitely you reopen your borders, that you open the airports. And even the airports reopening, there was an announcement, I think a month before the reopening. We didn't have all the time to do this proper arrangement and whatever. Now, we are not in normal times. You brought the people to come and work without due processes. It was strictly under the presidency. Yes, it's an emergency. COVID has become an economic crisis, not a health crisis anymore. So, what happened? And we are faced with a new virus, which is foreign to us. Because this is a UK variant. So how did it become a Ghana challenge today? When we had people kept to test people before they enter this country. You hear the MPP communicators when you go on others broadcast media platform with them. Some were even blaming the immigration people. So now, every flight, you have the manifest. You know the number of people who are in the flight. If the company that they claim are working are up to tax, you should know the number of people who are coming into this country. You should have the manifest of the flight and make sure that everybody is tested. We've had a lot of stories, even some members of parliament of this government claiming that their sons were telling them their friends came to the country, they didn't test, they had to pay bribe. All those tapes are there. And now Ghanaians are suffering. Unfortunately, people that they are minding their business, going about their job to take care of their families, these new variants are taking them away out of someone's negligence. And we are so not serious, we don't care. Ministers go before vetting. Minister of Health is not aware about the company that is doing the test at the airport. Minister for Foreign Affairs is not aware. So an ambassador will be coming into this country, probably he will be malhandled or something, and the Minister for Foreign Affairs is not aware of the company. They don't know anything about the contract. Even the health minister insisted the right thing should be done before he insisted, and the tax fraud report directly to the president. This is a clear failure on the side of the president and its apparatchiks. See, now this thing is claiming lives. It's so dangerous. The COVID-19 alone, we were not able to manage it. And now we have sat down upon all that they were taking at the airport. We have another variant, which is foreign again. Why does this government major in minors? Why? Why is this government not proactive at all? All they are interested is money. If the health minister is not aware of the company, because this variant was not with us. See now, it was imported into this country. And you are taking $150 at the airport for testing. COVID-19, that is a virus that is like a war, as my brother said, that we must fight. it has become connection man. They were doing business with COVID-19. That it is, and to understand that it is the president that collects the money from the airport, because if the Minister for Health is not aware, Attorney General was not even part of the, he said he had a lot of things, so some of the things might escape him or something. Foreign Affairs is not aware, and it's really under the presidency. What were they doing? Making money for family and friends as usual, with COVID-19 too. Senna, it is so unfortunate the people of Ghana did not vote for this government. So sometimes, because Ghanaians are tired already. We are tired, as the health minister said. When the COVID-19 came in, he said he was tired. The president is tired. Everybody was tired. And now, look at what we have at hand again. Then, even our medical professionals can't study the new variants properly and even give us the real symptoms. Some are saying it can attack your waist. This one, it is not the normal, like the flu, or maybe you'll be coughing. This one has, it has really spread its tentacles to understand that the help of those, the professionals who are supposed to handle it, they don't even have enough idea. So you can imagine me, a lay person, who has no idea about medicine and whatever. So you can't even, if you are trying to even prevent it, you don't even know the symptoms to prevent it, which is very, very dangerous. Meanwhile, we have paid people as watchmen to watch the airport for us so that we don't import such variants into this country. And they are comfortably here with us. And nobody is taking responsibility for this. Nobody, Osena, not the president, not advice, nobody. Everybody is normal, and the president has re-selected those people again to come to us and work again as health ministers and the rest. Because he was comfortable with them. They made money with COVID-19 at the airport. So they should come and continue. Other than that, this, I'm not aware, I don't know about it. It doesn't make sense. Mr. President, if Ghana was to be his own company, limited liability company that he has used his hard-earned money to set up, and the health minister was his managing director, and there is a crisis and you who are in charge, you come to me and tell me you are not aware, would that person be sitting there by now? But what do we see? This is Ghana. They are in to make money. Their fathers made money and left for them 60 years ago, so they are also here to come and continue. Nobody is taking responsibility for anything. Nobody is in charge. Everybody feels that this is our time. You meet their communicators and they don't even understand what is going on. They have been programmed. Like their vice president, they have been programmed. Whether the thing is blue or red, just say it is white. And they are just moving like that. All of their people have been programmed. They will be telling lies with so much confidence because that is what they have been asked to do. How can these few family and friends people put our lives at risk? Over 30 million Ghanaians. Doctors have been advising, then you come and tell us you are working with data and science. Science and data. You knew you were going to open the airports, yet you couldn't put measures in place. All you are interested in is to bring your friends to come and do business, then you share the money. You were reopening schools. You knew that schools were going to be open. You didn't send PPEs ahead of time, sanitizers, nothing. So now there is no education. As doctor said, who is even telling us how many hours you are comfortable to wear nose masks? Because the last time I heard Dr. Dakiwad Mills preaching to his congregants that you don't have to wear nose masks for more than a certain period of time because you'll be inhaling carbon dioxide. Who is teaching our children? Who is even educating us, we the adults? How many hours you're supposed to wear a nose mask? Nobody is telling us anything. COVID-19 came and the Kojo Nkrumah was eventually doing a reality show with it. You won't hear any adverts, not in any different languages for our people to appreciate and understand. You only see him talking. They think that they are still in their campaign mood and everything is about reality show. Catch the audience before they change their channel. This is governance. For goodness sake, we are not campaigning anymore, Mr. President. This is governance. You have the destiny of all of us in your hands. We have given you the power to rule. So now, this government was in power 4 years ago. We had COVID-19. He freely brought it and accepted it. And we are here. There's a new variant. So now, we don't know what's going to happen to us next year. Because these people are just careless, very clueless, and very heartless too. If it's not about them, I mean, a finance minister is flown out of the country because he had complications after COVID. So now, what would have happened to me if I also had the same complications after COVID, and that what it is required for me to get well is not in this country? You will die. And they don't care because I am not an Oforiata. So that I am not an Oforiata. So I should die for my family to lose whatever. After all, nobody cares. And he is flown out of the country. I wish him well. And I pray that he will be able to see whatever equipment they are using on him. So when he comes, quickly procure and get us those machines at the University of Ghana Medical Center. Because we are all human beings. Our blood is as red as his. Nobody has a blue-colored blood and others are having green and yellow. What kind of a country is this? It is the democracy we built that for family and friends, even in the midst of a pandemic, people are still self-centered. Thinking about how they can make money. What shall it profit a man? Say now, when you lose your soul and you get all these things, where will you take them to? Where will you take them to? If we could use money to get healing, why will people be flown out of this country? Could have just sent your money to do something for you. Then you get well, then you go about doing your normal business. Money is not everything, Mr. President. In politics or in governance, your main concern is the people. It is the people. The people's business should be your business. There is no publicity, even with the first variant. A lot of people are not aware of it. And now we are visited with something else, which its symptoms you can't clearly define. All that we could say is our people should take good care of themselves. When you are going to work, at least take more than 2 nose masks so that you can be changing them, because other doctors are saying you can't be inhaling carbon dioxide frequently. It can also kill you. When you are at a place where you realize there's so much space and no one is there, you can remove it a while and be moving around. When you are going back into where people are, then you put it on. Those of us who are used to an air-conditioned room, air-conditioned cars, let's roll the glasses down a little bit. Let the sunshine come into. Let's, get the vitamin D, the vitamin C, and the zinc tablets the doctors have been recommending. I have few friends that's got COVID, and even just yesterday, one went, and the result is back that she's negative. Thanks be to God. And these are the things that they use, and the steam bath. Those of us who can afford the 35 cedis vitamin C, you can use lemon and then ginger. The ginger is the zinc, then the lemon or the lime, you get the vitamin C in it. So now, this is what we should do to help ourselves, because as for this government, if everyone dies and he and his family members are only in Ghana and he's still a president, I think he's very comfortable with it. Parents that are in school, let's make sure that our kids go to school at least with 3 nose masks. The one that he or she wears or they wear from the house, maybe during lunch, the child can change it. Then closing time, she changes it into another one so that they don't inhale the carbon dioxide that other medical professionals are saying it's not also good for our health. Let's try and share the little information that we have to save lives and help our people. As Doc said, the information is limited. Even with this new vaccine, they are saying they are going to look at the vulnerables. And honestly, with COVID-19, I don't know who is more vulnerable than the other. Because if you give Dr. Clement a pack because he's an MP, today he's sitting here with me, I don't have the vaccine. So what happens? When he goes home, his domestic staff doesn't have the vaccine. So we are virtually, it's a cost-90 job we are doing. The president or the government should think. We are paying Anadu should think and give us solutions. If it's going to be district-based, regional-based, whatever, it should, the proper things, because you can't, immune someone and then the next person closer to him or her can be COVID prone. At the end of the day, what have you done? And those that get the vaccine, what is the probability that when you receive the vaccine, you won't get the COVID at all, or it's going to minimize it, or when you get it because of the vaccine, you won't die? Those that their immune system are strong, those that have recovered, are they still going to take the vaccine? We need a lot of information. Has the vaccine been tested? Yesterday, I heard the Minister for Information and I think the Health, Professor, the one in charge, the government advisor on health issues or something. They were saying, it's yes, that the vaccines are potent and whatever is not because others have certain reservations. Has it been tested? They should communicate to us. Where? In Ghana, who tested it? The health minister, the Minister for Information, does he have an experience? They should be tested first. They should take them first and they should share the experience with us. You can't risk all of us, our lives. I mean, there should be tests, proper laboratory tests. Even the Frontier Healthcare Company or whatever at the airport, there is nowhere in this world that they have any track record of laboratory tests. So how can you put these people in charge of testing? And today, we are here with another variant. Sena, the MPP has failed. They have failed. I don't know what definition I can give this government, but at least a nation that is not healthy, you can never be productive. Nana Addo promised us 88 district hospitals. And today, we are hearing that it was a vision.
Actually, they say it's now 111.
111 from the 88.
Even one, you've not done it. And now they are saying it was a vision. So anybody can go and sleep and get a vision and can tell Ghanaians.
Yeah, I can go and drink buku too, and then I can go
and tell us.
Now
when we are supposed to be. And this vision, it was time bound. He said within 1 year. Oh, Sena, Ghanaians, we have suffered though. We have really suffered. And these people should listen to reason and save our lives. And save our lives for once, if for nothing at all. As for health issues, Nana, build the hospitals. You promised us. Nobody forced you. It was in the NDC manifesto that we're going to build new hospitals at the newly created regions. Oh, he jumped at it again. Yet nothing is done. And I heard the health minister designate was blaming the chiefs for not giving them. So when Nana was seeing the vision, he didn't see the need in consulting the chiefs and staff and to get lands and all that for the work. He is not serious. Sena, in simple terms, Nana Addo is not a serious person. He is not. They want to make money out of everything, including a pandemic. COVID-19 is now a connection man for the MPP government. Ghanaians, please, let's take good care of ourselves. If you are not supposed to go out to do anything very important, please stay at home. The virus moves as we move. Let's take good care of ourselves. Let's stop the hugging, the shaking of hands, crowded places and all that. And let's hope maybe Providence will protect us, whilst we are also trying to keep ourselves clean and follow the protocols that have been put in place, wearing of nose masks, washing of hands with soap and water, then social distancing. And let's see, because as I sit here, Sena, I don't see how this government can solve this problem. I don't want to sound too political, but with the Nana Addo that I know and his track record, Nana can't do anything about this.
Thank you.
Thank you.
Thank you very much.